is your approach to the treatment of Lyme disease?
To me, the Lyme or co-infections, viruses, all of that, need to be looked at, addressed, but you have to start with the terrain. So addressing the terrain from the GI, from the nutritional standpoint, whether it's initial food elimination, addressing the initial hormones, cocktails, and the IV support. The question is at what stage do you start going towards the Lyme treatments in terms of is the body ready to either address the Lyme at all.
So you're not the type of doctor that will go start with IV so strong immediately.
No,
you will try to see the body first, how to heal it.
Yeah, everybody comes in at a different point. History is consistent with someone who has been very chronically ill.
Yes.
You really need to know what's the best starting point for them.
So you think it should be a lower treatment?
Yeah, and that's what I do. Being both an MD and a naturopath, I like to come in with safer choices. I do feel that although I'm a member of ILADS and obviously learning from the conference here today with Dr. Kalidas and the other practitioners, I think it opens up more avenues and opens up more doors. Definitely more interested towards where Dr. Kalidas is going with the whole approach, because it seems that the traditional, whether it's IDSA or the ILADS mode, or even now where we are, we have to realize that you have to support the body rather than getting too caught up in the bug.
And that people is not getting healed in 2 weeks antibiotics as the IDSA is stating.
No, but even with ILADS, the question is, are we going to put someone on a 12, 18-month, 2-year, 3-year program? And I always believe that we have to support the entire body in getting to the best healing.
Plus we had studies here like Dr. Fry, Dr. Sapi, who are saying that there's a filarial infection. Then he's saying there's a new protozoan. So there are many things that probably have not been defined in Lyme disease yet.
Yeah, we are looking at some other therapies that we're using in our office. We do use ozone therapies. We use IV vitamin C's. We just acquired a new machine in our office called iTherm, where we might be able to use heat, because understand the heat will cause fever. Fever can cause a reaction where you can break down things and cause a healing crisis.
Kill the bacteria.
So the question is, where do we bring this in? And this is some of the newer therapies that we are looking at. So in my own learning and based on what we are, I think the newer techniques we need to look at supporting our patients where we are addressing both neuropeptides, the whole issue with CCSVI, how is that going to connect?
Yes.
What's the easiest way of defining the problem? And
because it's a main problem.
And and finding easier answers before we send them off to all parts of the country for the support. So
when you gave a conference and in your office, you gave a conference, and my question was, why would you take this huge challenge? Why did you decide to do something like this? This is very hard to heal, very hard to treat, and is not as rewarding as maybe treating. Why would you do this?
Well, part of the challenge as a physician is that we want to help patients, and my going back to school, even as a naturopath 10, 12 years ago, was to further my education, be open, and realize that a lot of the people were falling through the cracks on the medical side. And even now, when I came back and started practicing as an integrated physician, I realized that okay, some responded to the thyroid, some responded to the adrenals and the dietary changes. But as I grew in my practice, I came to realize there were more and more chronic patients that really needed the help. And that's how I got into the whole Lyme and viruses and co-infections and all the other arenas. And I'm realizing more now that those complex patients, they can't, there's no one to support them.
No one. And not in Florida.
Yeah, and very few physicians to support them in the best way possible, realizing the depth of the illness, understanding it, have a good understanding of where they are coming from, and trying to support it the best way possible. And that's my goal.
So you have to tell me in camera, is there Lyme disease in Florida?
Lyme disease is prevalent in Florida. I know of pockets in Central Florida, even in our community in Orange County. It's close to the Lake Nona area. There are pockets up in Lake Mary area where we've diagnosed Lyme patients. endemic in that area.
So now you're treating with antiparasitics. Are you incorporating
well,
it in your
I'm
treatment?
using more natural antiparasitics, but based on the information given on this weekend, and obviously with Dr. Kalidas, he being more of an expert in the arena, and also Dr. Amin's lecture on parasites, and how symptoms can sometimes be either aggravated or the rate of progress will be further mitigated if you don't treat the parasites first. So I think we need to change our paradigm shift, because the IDSA is one idea, ILAN's practicing physician has one idea, but I think we need to be open to the change that Dr. Kalidas is bringing in the industry. And as he mentioned in his lectures, that he is open to using strong antiparasitics in his practice. So I need to study those, get more familiar with some of the protocols he's implemented. And I'm willing to step up in that area.
Wonderful. And I don't want to get you into trouble, but it's so controversial to treat Lyme disease. It's so risky. Doctors are even risking their licenses. What do you think about that political arena that's hurting the science and the medicine and the medical field in treatments?
Well, I think, and the problem lies in medicine, where we're trying to put everything in one box, one treatment, one drug, one treatment, one result.
Yes.
And because that's the training that medical doctors go through, they expect the same in this arena with chronic fatigue, fibromyalgia, chronic Lyme, and the multiple complex symptoms that patients come in with. Unfortunately, the walking wounded who've been labeled with chronic fatigue and the fibros and the IBS and the chronic, and those who are completely being debilitated over time. Unfortunately, those are the patients that come and see me. So my patient practice and word of mouth is what brings patients to my office. I do have to be guarded in terms of what I do in my office, but at the same time, I practice with the safety in mind and with the standards of care that is healthcare that is required by state law. But I'm willing to step up to help support my patients with their needs.
But honestly, it is not fair to have the doctors having to take care of themselves.
Yeah, unfortunately, we are faced with that. But I think I always believe in the truth, and I'll stick to the truth. And to me, the truth will prevail, and I always stand for that. And that's why I stand with my patients. Thank you.
God bless you. Thank you, doctor.
As the journey continues for all of us. And in my office, we won't give up. We have the whole team here.
Thank you for those words.
Dr. Macheski was an OBGYN. He's learning about Lyme because of the hormone issues. And then we have Mike, who's a PA, and Dr. Franson, who's a nature.
We needed to hear those words, that you're not going to give up with us.
No, we don't.